Hello, and welcome to Dietary Approaches to Stop Hypertension, Diet and Health Outcomes. My name is Mandy Massarella. The project goals are to increase control of high blood pressure in adults, and this is in line with one of the leading health indicators from Healthy People 2030. Another project goal is to show the effectiveness of adopting and adhering to the DASH diet. High blood pressure is also known as hypertension, and it places individuals at an increased risk of heart disease. Overweight and obese individuals make up 2/3 of the hypertensive patients. High blood pressure is one of the important modifiable risk factors of heart disease. According to the Center for Disease Control and Prevention, heart disease was the leading cause of death from 2018 to 2021. 48.1% of adults in the U.S. have hypertension, and 22.5% of adults have their blood pressure under control. $131 billion are spent annually, and that's averaged over a 12-year period from 2003 to 2014. High blood pressure can affect other organs such as the eyes, the brain, and the kidney. The DASH diet has shown to improve other health outcomes, such as improvements in cardiovascular risk factors, heart failure in adults less than 75 years old, stress and sleep disturbances, possibly breast cancer and other cancers, and neuropsychological functions such as depression and anxiety. This chart from the CDC website is based on the American College of Cardiology and American Heart Association 2017 guidelines, and it gives a list of blood pressure, normal levels, elevated, and stage 1 and stage 2 hypertension. Stage 1 hypertension just starts as systolic blood pressure between 130 to 139 millimeters of mercury over the diastolic blood pressure of 80 to 89 millimeters of mercury. Blood pressure varies by sex, race, and geography. As you see here in this graph, men are more likely to have high blood pressure than women. And by race, non-Hispanic Black individuals have a greater prevalence than non-Hispanic white, followed by non-Hispanic Asian, and then Hispanic adults. This map is a graph of the hypertension prevalence in the United States. The southeastern United States has the highest prevalence of high blood pressure. The areas dark in red are known as the stroke belt, and they include states such as North Carolina, South Carolina, Georgia, Alabama, Mississippi, Tennessee, Arkansas, and Louisiana. The greatest prevalence of stroke mortality is along the coast of North Carolina, South Carolina, and Georgia, and this area is known as the stroke buckle. What's interesting about this map is the prevalence of high blood pressure is self-reported, so that excludes the many Americans that are unaware of their blood pressure levels. The dietary approach to stop hypertension DASH diet. The National Heart, Lung, and Blood Institute promote the DASH diet. The National Heart, Lung, and Blood Institute, along with research, developed the DASH diet over 20 years ago to decrease blood pressure and cardiovascular risk factors. The DASH diet is flexible, modifiable, and convenient. It can be modified to meet any dietary restrictions such as vegan, gluten-free, halal, kosher, and low-fat. The DASH diet is rich in fiber, calcium, magnesium, and potassium. The DASH diet limits sodium to 2,300 milligrams, and more benefits are seen with the restriction to 1,500 milligrams, and this is especially important with diabetics and individuals with hypertension. The DASH diet was voted number 2 diet in the U.S. News and World Report 2024. Studies reveal individuals with high blood pressure who adapted the DASH diet and maintained low sodium had the most significant decrease in blood pressure. Adherence to the DASH diet also showed reduction in BMI, waist circumference, cardiovascular risk scores, and other health outcomes. The DASH diet promotes fruits, vegetables, legumes, lean protein, poultry and fish, whole grains, nuts, seeds, no fat and low fat dairy, and healthy oils. The DASH diet limits salt, red meat, processed meat, fats, simple sugars, desserts, high fat dairy, tropical oils, and alcohol. The DASH diet does not restrict any entire food group, and it has no counting of carbohydrates or counting points. According to Al-Noon et al. In 2022, physicians have insufficient resources, time, and knowledge to perform nutritional counseling. With the increased communication technology, this supports self-management of chronic diseases and self-monitoring. Mobile apps can help assist and manage blood pressure control and adopt, improve, maintain the DASH diet and adherence. These apps are in the early stages of development. They use behavioral change techniques and theoretical domain framework. These mobile apps are promising in low and middle income countries to promote healthy diets and physical activities. Public health implications and findings. As health education specialists, we need to promote early prevention of high blood pressure. We need to screen for high blood pressure, act to lower and control high blood pressure, lifestyle changes in medical management as appropriate, and adopt healthy behaviors, healthy eating, physical activity, preventive care, and self-management, and the importance of this primary prevention early in life. And it's not enough just to promote prevention. We need to eliminate health inequities, build neighborhoods and strong communities, safe spaces for physical activity, and facilities for health care and screening and monitoring, improve economic stability, transportation and accessible health care, and improve the ability to find and access health information to decrease language and illiteracy, decrease health illiteracy, and decrease digital illiteracy. An overview and methodology. A literature review and literature matrix was performed using a database search through Google Scholar, PubMed, government websites, CDC, NHLBI, NIH, and the world-known research hospital Mayo Clinic. Screened articles and full text articles in 12 of them, 3 reports, and 2 newspaper reviews. Keywords searched were dietary approaches to stop hypertension, DASH diet, hypertension, high blood pressure, heart disease, cardiovascular disease, sodium, and salt. Studies with adherence to the DASH diet and sodium restrictions or physical activity showed a statistical difference in decreasing systolic blood pressure and diastolic blood pressure. The DASH diet had a greater impact on younger adults, women, Black adults, and non-hypertensive individuals. Recommendations: lifestyle modifications and behavior change. Adapting and adhering to the DASH diet low in sodium, and participating in physical activity, self-management, blood pressure monitoring, follow up with a physician, yearly blood pressure screenings, and as needed for preventative care and medical management, accessible health information, and further research is needed with mobile apps and their effectiveness to adhering to a DASH diet and the effectiveness of the behavioral change techniques and their theoretical frameworks, as well as increased security and personal data with those mobile apps. Thank you for joining me for the Dietary Approaches to Stop Hypertension, the DASH Diet, and Health Outcomes.